فليتفضل الدكتور إسماعيل حجر استشاري طب وجراحة العيون مركز رواد النور لإلقاء التوبكس why is not trap. شكرا.
السلام عليكم. كل عام وانتم بخير إن شاء الله. My topics today, I changed the title to when GDD is first for glaucoma devices is first. First, I'm going to go through introduction that Dr. Muhammad has already passed through it. Glaucoma is a leading cause of blindness worldwide. Treatment for glaucoma include use of eye drops, laser, variety of surgical procedures. The current standard as initial surgical procedure for glaucoma is trabeculectomy. Glaucoma drainage devices are used when medical, laser, and conventional filtering surgery failed. During the past few decades, GDD has become an accepted alternative to other surgery, even as a primary surgery. They are useful, especially in managing complicated glaucoma as a standard surgery, carry high risk of failure. I'm going to go through a big study, the tube versus trabeculectomy, which held in 2008. Multi-centered. There are some questions I put. What questions was the TVT study designed to answer? The TVT study was designed to compare the safety and efficacy of non-valve tube shunt surgery to trabeculectomy with mitomycin C in patients who had previously undergone intraocular surgery. How was the study designed to answer the questions? The TVT was multi-center randomized clinical trial that includes 17 centers. Participants were between 18 and 85 years of age, had previously undergone trabeculectomy or cataract extraction with an implantation of an IOL, and had uncontrolled glaucoma with IOP ranging from 18 to 40 millimeter mercury on maximum treated anti-glaucoma medication. What is the most important clinical take-home message from the TVT study? Is more efficacious to implant a glaucoma drainage devices to control IOP than to perform repeat trabeculectomy on patients who have previously had intraocular surgery, especially who has underwent trabeculectomy. When do we consider GDD as a primary procedure? Common indication, traumatic glaucoma, neovascular glaucoma, uveitic glaucoma, post-penetrating keratoplastic glaucoma, glaucoma associated with keratoposis, silicone oil glaucoma, glaucoma following vitreoretinal surgery, infantile and juvenile glaucoma, glaucoma in aphakic and pseudophakia, ICE syndrome, with the glaucoma, Axenfeld-Rieger syndrome, with the glaucoma and Sturge-Weber syndrome, glaucoma due to epithelial ingrowth, scleral thinning. As we know, when we do GDD due to traumatic glaucoma, is indicated post-traumatized within conjunctival or scleral injury that proceed or that preclude conventional filtering surgery due to thinning or scarring of the conjunctiva and alternating of the sclera. In case of blunt ocular injury with disturbance of anterior segment and the vitreous body, GDD are indicated, and the tube is directed in position away from the affected side to prevent its blockage by the disturbed vitreous. Inflammatory glaucoma, including uveitic and neovascular glaucoma, as we know, the failure rate of trabeculectomy is high. GDD is indicated in these cases to control IOP. Post-penetrating keratoplasty glaucoma. BKV may induce glaucoma in many ways due to using steroid and sometimes due to trauma to the eye. PPK glaucoma is one of the common complications after penetrating keratoplasty, many of which may require surgical intervention in case with associated ocular morbidity like existing peripheral anterior ocular anatomy. The chance of GDD surviving is higher than trabeculectomy. A successful control of IOP after GDD was noted 98% to about 90 to 100% of eyes 1 year after BKB and 82% at the end of 3 years. This is according to a study. Glaucoma associated with keratoposis, as we know, the sclera and conjunctiva and cornea are disturbed in keratoposis. About 2/3 of patients undergoing keratoposis have glaucoma. These patients have very poor ocular surface, including trabeculectomy. The GDD has been found to reduce IOP effectively, is seen as an absolute indication for GDD in these cases. Glaucoma in aphakia and pseudophakia. In case where extracapsular cataract extraction or manual small incision cataract surgery has been done, GDD are the necessity of surgery if the IOP is uncontrolled. In the tube versus trabeculectomy, the study first that I mentioned before, in patients who had undergone previous cataract extraction, intraocular lens implantation, and failed filtering surgery, GDD had better control in IOP than the trabeculectomy group at the end of the 5 years. In aphakic glaucoma in children, trabeculectomy with mitomycin C successfully controlled the IOP only in 29 to 33%. Another study, there was significant reduction in IOP in both the trabeculectomy group 73, the 0.3%, and GDD group 86.7%. However, it has been found that the treating glaucoma in children less than 2 years, GDD had a much better control in IOP than trabeculectomy, 19% plus minus 7% and 53% plus minus 12% respectively, which are a great gap between them. Iridocorneal endothelial syndrome, eye syndrome. Management of glaucoma and eye syndrome is challenging due to proliferation of the endothelium and causing peripheral anterior syncytia. To avoid the GDD are the preferred surgery in managing these cases, but the lumen tip might get occluded over a period of time. There is a continued proliferation of ICE membrane. To avoid the blockage of the tip lumen, the tube should lift longer than usual, preferably in the sulcus or pars plana region. GDDs have been reported successfully control IOP in about 70% at 1 year and 53% at 5 years. Glaucoma following vitreoretinal surgery. Secondary glaucoma following retinal detachment surgery, silicone oil induced GDD glaucoma. GDD managed surgery for many reasons if IOP is controlled. GDD can be implanted even if the conjunctiva is scarred due to vitreoretinal surgery. Unlike trabeculectomy, GDD can be put inferior temporal or inferior nasal quadrant. Management in pediatric glaucoma. In primary congenital glaucoma, where the disorder is only trabeculokinesis, tube implantation is considered if trabeculectomy has failed and the eye has a reasonable potential for maintaining vision. In case with multiple failed trabeculectomy leading to conjunctival scarring is advanced, is advanced glaucoma, in advanced glaucoma with scleral thinning, where the fashion of trabecular flap may not be possible, the tube implant is the primary procedure of the choice. Additionally, there's a variety of secondary glaucoma that have a poor prognosis for success. For initial goniotomy or trabeculectomy, such as aniridia, anterior segment dyskinesis, Third-Weber syndrome, and aphakia, when further intervention is required. For refractory cases, the options vary according to the individual patient's factors and preference. The surgical alternative includes filtering surgery, cyclodestruction, and procedure and GDDs. Summary. Surgeons typically keep GDD as the last reserve for control of IOP, but the GDD has gained more popularity with a shift in practice pattern and over time and initial treatment because of treated complication associated with trabeculectomy. The final choice of surgery depends on surgeon preference, but when managing high-risk glaucoma patients like to need future surgery or patients where the follow-up is questionable, the tube implant procedure is preferred. Thank you very much.
السلام عليكم ورحمة الله وبركاته، ونرحب بكم جميعا بجميع الأساتذة والدكاترة العيون في اليمن جميعا، ونشكر القائمين على الفعالية اليوم العلمي الرائع، شركة الجزيرة والخليج والدكتور محمد الحميري، ونشكر الدكتور إسماعيل حجر للبرزنتيشن الذي قدمه، كان رائعا وجميلا.